Okay, thank you very much. So we are going some way to continue on this topic of how to communicate and how to govern genome editing, with some focus this time on human genome editing. We will have the pleasure to welcome first Eric Meslin and then Alta Charo. So I'm going to say a few words first of Alta Charo. Alta is the Warren Knowles Professor of Law and Bioethics at the University of Wisconsin. She's a member of the US National Academies and co-chaired the Committee on Stem Cell Research and Genome Editing. And with Jennifer Merchant, they were involved in the first report of the Academies on Science and Society pillar. She was also a member of the Presidential Commission of Bioethics. And now she serves on the WHO Advisory Committee on Global Governance of Genome Editing and several committees, so much I can't tell you. Eric Meslin was trained as a philosopher and a bioethicist. He is currently the president and CEO of the Council of Canadian Academies that gathers 3 academies. He was the founding director of the Indiana University Center for Bioethics and associate dean for bioethics at the Indiana University School of Medicine. He's currently a professor at the Danalana School of Public Health, University of Toronto. He was involved in many committees, here again at the Presidential Bioethic Committee of the US. And it's an honor for us to let the floor now to Dr. Meslin for 15 minutes and then Alta Charo for 15 minutes. Thank you for joining us.
Thank you very much. It's a pleasure to be here. I wish we were all able to meet in person, but as we know, the world is not allowing us to do so. So I hope everyone is well in their own homes and with their friends and family. It's a pleasure to be with you, and I'm going to just speak for a few minutes, not to use slides, partly because I think it's one effort to try and humanize our discussion. I'm not going to be presenting data. The title that I gave myself was Reflections on Emerging Developments, which is about as abstract and non-convincing a title as you might wish to think. And that's largely because I want to reflect on a couple of things that have been moving relatively quickly in this field. I really just want to make 4 points, probably obvious to everyone, that this topic, not just CRISPR-Cas9 technology, but genome editing and the entire genomics field has been moving at a rather breakneck pace for probably the last 20 or 30 years, using the very unscientific method of going on to Google. If you just type in gene editing today, you'll get about 239 million hits. If you type in genome editing guidelines, you'll get another 100 million hits, and on and on. There is no curation to this flow of data or who gets to claim what. There is no quality assurance. There's just lots and lots of information in an open environment, which makes it quite difficult to make sense of what is useful, what is evidence-based, what is speculation, what is anecdote. Now, this is not just an observation about the risk of misinformation, but rather it is explaining to us a little bit about the specialization process that is occurring in this field, and indeed a subspecialization process. There are experts now in the very granular areas: plant, animal, human, governance, clinical trials, quality assurance, health technology assessment, and governance. This is no longer a time when one person can be competent in or knowledgeable across fields. And in fact, governments and civil society are facing this problem of how to interpret this massive tsunami of information, whether it be on ethical, legal, or social issues, or whether it is on the data itself. This, on the one hand, is worrisome, but I have a bit of an optimistic gene, and I see it as somewhat democratizing, that there is more information available. It's incumbent upon us, of course, and organizations like this to be very clear about what information does pass the test of, if not peer review, then at least high quality review. And I say this just as an opening first remark, because today we're having this conversation, and just a month ago, it probably would have been a slightly different conversation. Maybe 2 months ago, it would have been a different conversation. Before, for example, the Nobel Prizes were handed out, we might have been having a different interaction about the role that science is going to play, or the publicity of this topic. The second point is that there are many organizations weighing in. My dear friend and colleague, Professor Charo, may be speaking to this, so I don't want to step on her toes. But she, as you announced in your introduction, and others on this in this organization, are involved in many committees, panels, working groups, and other organizations. I didn't count the number. One of our colleagues in the field, Françoise Baylis, has written a paper that describes what the laws are in many countries. So this is a very active area of work with lots of organizations weighing in. This itself is gratifying, but like the data point I just made a moment ago, there's a kind of incommensurability between the kinds of organizations that are claiming knowledge of or expertise in, and those who are just weighing in because it's interesting or curiosity driven. So of course there are governments and many orders of government, not just federal or national governments, but I live and work and have lived and worked in both Canada and the United States. And there are quite a number of differences between how provincial governments in Canada and state governments in the US think about, consider regulating or legislating any of the aspects of genomics, let alone the particular aspects of gene editing. There are regional groups. Of course, the European Group on Ethics is well known to this group. ARRIGE itself would be considered an organization that has high competency in this very area. And of course, we have professional science organizations. You mentioned the one that I work with, the Council of Canadian Academies, a bit of a mouthful. We like to think of it as Canada's little cousin to the US National Academies. It's much smaller, but it does do the same sort of thing. It's an organization of the learned societies, or three of the learned societies of this country: the Royal Society of Canada, the Canadian Academy of Health Sciences, and the Canadian Academy of Engineering, not dissimilar to what the US National Academies has with their triumvirate. So there's lots of different types of groups weighing in, and that's not to leave out advocacy organizations, patient care organizations, NGOs, public-private partnerships, the private sector. It's quite a busy environment. I mention this because there seem to be more and more participants in the domestic and international conversation about these technologies. What I do want to make an observation about, and I think it came up in the Gene Drive session just a moment ago, is the need for us to ensure we recognize the global north, global south, to borrow a kind of arbitrary distinction, discussion. There's a risk, of course, that focusing only on the topics of this area of science as a matter for technology development and healthcare access, or even agricultural or animal welfare issues, are limited to the global north. This will be an enduring bioethics and, I think, social challenge that we're only just beginning to appreciate. I said I had 4 comments. I'm going to raise my third one now, and it sort of flows from the long list of organizations. And of course, organizations do a number of things. They may write guidance or standard operating procedures, professional practice standards. The list of instruments, in other words, of policy development, is probably as long as the number of organizations who write them. Now, of course, no 2 documents have the same force. Some of them may have legal force, some may have moral force, some may have public relations force, and some may have commercial or other private power. What it suggests, though, is that in the absence of a kind of unifying theme for how to organize, make sense of, and harmonize the different documents, what we are left with is quite a significant volume of statements, declarations. There will soon likely be treaties, I can imagine, that are emerging. Just the two organizations that you mentioned in Alta Charo's bio sketch, a WHO committee, a National Academies committee, two very distinguished organizations. And while many know their counterparts on the other committee or were themselves on one of the other committees, we don't have a World Science Court. We don't have a World Ethics Court. We don't have a kind of meta governance structure that can adjudicate differences between them, legitimate differences, but adjudicate differences between them. This is not a problem that must be solved, but we are in this almost ironic position of kind of a candy store in governance. You know, many years ago, we were looking for guidance documents, and there were very few. You know, back in the days of the early recombinant DNA technology debates, when now everyone is quite aware of the Asilomar meetings in the middle 1970s, producing a document that was at the time one of the few in the world. And now our problem is not looking for documents, it's that we have hundreds of them. They're coming out almost daily. I'm exaggerating because I know it's late where many of you are, and I want to make sure that people are paying attention. But we do have many documents without an adjudicatory mechanism for distinguishing between them. This is really important for a couple of reasons. And one of them flows from the recent human heritable gene editing statement that came out just a little while ago. My good friend Kevin Davies, the editor of the CRISPR Journal, put together a compendium of comments from many people around the world. I happen to be one of them. We were given 300 words. What do you think about this report? Well, for those of us, particularly people like me, for whom 300 words is a throat clearing exercise before I get to say anything, there's not a lot that you can say in 300 words about a report that is not only thick but comprehensive. And yet the careful reading of that National Academy Royal Society report is, I think, required reading because of the nuance, because of the kind of pragmatic shift that you start to see in ethics and governance towards what would be the conditions under which we might permit this, rather than never shall this occur, it should never happen. The end result of the deliberations were no. I think it's important that the documents themselves, not just because of their volume, requires the careful attention of both civil society and the public, but requires a reading in chronological order. Many of us are aware of and may even have been involved in debates and discussions on a lot of these topics. But it would be irresponsible to simply pull one out from 10 years ago and sort of use that as the standard or received view. I find it is quite difficult to keep up with the latest position, especially when it is a nuanced position. We will wait with great interest for my friends at the WHO to come out with their statement. I don't know that they will be speaking directly to the National Academies Royal Society statement. It would be odd if they didn't note that it existed. We're all reading everybody else's work. So I think this creates what I would call a challenging environment. Let me close with my fourth and final point, and this is sort of going back to my roots in philosophy and bioethics. And this presentation is actually going from probably the most evidence-based to the most philosophical. So I started with there's lots of data out there. Let me just finish with a similar comment about there are lots of ethical perspectives out there. And those perspectives are often and have historically been captured with endless lists of ethical principles. There's a long history in the field of bioethics where the listing of principles is seen as a sensible and pragmatic strategy for explaining difficult moral problems. There have been pushbacks on whether that approach to even using principles is sensible or not. That's not my point. In fact, the list of those documents that I mentioned oftentimes contain sets of what is now becoming quite a comprehensive list of principles. I'm not saying that people are picking and choosing the ones that they want, or that there is a limited set of ethical principles from which various groups decide which they want to adopt for their own particular use. And I'm just going to read from my own notes here, a comprehensive but not exhaustive list of the principles that have been described just in the last 2 or 3 years in the last few international documents include the principle of precaution, consent, autonomy, balancing risk and benefit, safety, harm reduction, social contract, justice, access, fairness, shared benefits, avoiding discrimination, protecting the vulnerable, choice, reciprocity, and transparency. I have left out many others. So it's not enough to simply say the way that we ought to move forward is with good evidence, which of course we must have, with a good moral foundation, no one disputes that, and with good public engagement and awareness, because this can't be limited to the experts. So I would close, and I'm surprised that even I can get this done in exactly 15 minutes with 51 seconds to go. My perspective or reflection on emerging developments is that this doesn't end. Today's meeting is just the first story or the first chapter in what will be a conversation that's going to happen tomorrow. And when the WHO report comes out, this organization will have another discussion and many others will, and it will keep going. I rather like that. I will finish on the optimistic note that I think this is exactly what should be happening with a fast-moving technology. We will never just answer the question and say we're done and move on. We're now at the point where we've got using these various instruments of policy and the internet to get more information. Thank you very much.
Wonderful timing, Eric, and